Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.
And we're back. And as we promised earlier, today, after yesterday's press conference, there are a lot of questions that people have about the vaccinations and the variants. So we decided to ensure that we could bring you the answers to some of the questions that you have. Should you get vaccinated? What are the risks? What are the concerns you have? And what does having a new variant in the country mean? So we have two medical professionals with us, very well-known faces, also members of the task force that helps to advise the Ministry of Health. We have Dr. Jorge Hidalgo, and we have Dr. Fernando Cuellar, both intensive care specialists at two separate institutions, Belize Healthcare Partners and Belize Medical Associates. Good morning.
Thank you.
Good morning, Marlene.
All right, gentlemen. So let me just start off by getting your reaction as to where we are today with the COVID-19 situation. Let's start with you, Doctor.
Yes, well, as you know, and we have recently the news that in the country we already have the variants. No? Mm-hmm. Essentially what we have right now is a test that we call it VOC. And VOC is basically a test that essentially gives flags that we have a various of concerns. Mm-hmm. Then we need to essentially explain that we have three different type of variants. One, variants of interest. I mean that in those cases we have the identification of small clusters in a specific region. Mm-hmm. That call our attention, and then we need to basically do all the epidemiological measures to try to see what is happening. But in that situation is basically have the ability to contain. Mm-hmm. Now we have also the variants of concern, where definitely as we know already, we have the different variants, the alpha, the beta, the gamma, and delta. Mm-hmm. And if we have variants of concern, then that's basically flags for the country. It doesn't matter what variants we have. We need to implement whatever epidemiological measure are needed to control, a part that we need to report to the WHO that we have already identified some variants of concern. And of course, those different samples need to go for sequencing and trying to identify. Mm-hmm. But in any situation, the most important thing is that we know that those variants are already in the country. Mm-hmm. And the other variants is variants of high consequence. Mm-hmm. But fortunately, not in the world, we have reports of those type of variants, and we don't want.
Yeah. Now, yesterday on the show, Minister Shabat did reveal that our tests locally have detected a variant. He went further to say that the medical team that advises the Ministry of Health feel very certainly that this is the Delta variant. And being a part of that advisory team, I want to hear from you why you think so.
Well, I think it's proper for us to, because we are speaking to the general public, don't we have to rock it down like we like say. Mm-hmm. We use words like variant, I think, too loosely. Okay. But variant means one mutation, one change in the original virus. Mm-hmm. And it has been happening all over the world, so why Belize would be the unique spot where it would happen, no? Mm-hmm. So concerns came about, and serious came about maybe a month and a half ago when we had discussion with the Ministry of Health that, hey, something is happening. And unfortunately, over the past 17 months, we should have already put in pathways to identify variants quickly, okay, and opportunely, okay. Mm-hmm. So I think that's a little slip down. We have to talk the truth over and over. We slipped down that we didn't put things in place properly. We try to. Things come with money. Things come that we have to rely on other people. But we could have put in solid pathways to have identified the variants some time ago, okay? Yeah. We rely on collaboration, but sometimes collaboration are like, they help you, but say the hard cash here. I want to send one sample that X place, and I need one result in 2 weeks or 1 week and a half. So I think hopefully that is in place now, that we can identify the different classes of the virus that have changed over the past 18 months. Recently, we talk about the alpha, beta, gamma, delta. They used to call them by numbers first, which may be very confusing.
Yeah,
then
or
they
by
used to
countries.
Call it by countries, which countries catch feelings. Like, no, call it the UK, because they're not we responsible for it. So they come up with one better name calling of it, not the alpha, beta, gamma. And we feel like, given what we've seen over the past 2 months, perhaps it might very well be the famous delta that's originated supposedly out of India, no?
And that's another critical point I wanted us to tackle. Why is the whole world concerned about the delta virus?
Because it's easier for transmit, Marlene, okay? I mean, it's easy. The virus has mutated, has changed, and every virus do this. This is not only for COVID. Every virus do it. That's how they survive over the years. They're smart, they're genetic material, they have all of this thing inbuilt
it's like
in
the
them.
flu. The flu change.
Exactly. So every year you have to get a new flu vaccine for the same reason. But that's the way how viruses survive over hundreds, if not thousands of years. You know, they do their own change. And this change that happened is that for ensure their survivability then. The virus survive by changing, by adapting. Okay? So this one, they adapt that you don't need one lot of virus to infect somebody else or sicken somebody else, meaning it's more catching.
Yeah. You catch it easier than you would have caught the original COVID-19. Is it also more dangerous?
Well, the situation with that, well, just to answer the question that you ask, there are no ways we can say that we have the Delta variant right now. But again, as I mentioned, the VOC test is telling you that you have the variants of concern, and there are 4. I mean that, of course, what is happening that the dominant before was the alpha. Now, of course, what we seen in other countries is that the delta is becoming the dominant. I mean that based on what is happening in other countries, then it's easy for us to think that the delta probably is one of the one that we are more, you can say, expecting to have in the country. I mean that's one of the things. And of course, if this is the case, then we see, as Dr. Cuellar mentioned already, is that this is more transmissible. And if it's more transmissible, means more number of cases. That means more potential hospitalizations. And of course, if we have more cases in the hospital, the health system is in a strain, potential cases in ICU. And of course, we can see probably the possibilities of increased deaths as well. No?
So that's the key factor there. We had an overwhelmed healthcare system with the original COVID-19 variant, which, if I can remember, they were saying you had to have at least 15 minutes of exposure to really be at risk. Now, because this one more catching, it's less time. So a little bit of interaction, you may get the virus. And with more people getting it, we may have more severe people who end up in the hospital, more severe symptoms that end up in the hospital. That's the concern.
Yeah, I mean, again, back to your question, is it more deadly? We don't think so, but because more people want to catch it, that more people want to get sick, more people end up in a hospital, and more than likely more deaths will happen. And that has been shown over the world. That's what happened, for example, in India, no?
Yeah.
A lot more people. And you touched on that point, and I do want to highlight it. Please, I want to criticize press conference yesterday because they make it sound like, hey, we set, we cool, we ready for anything. That's not the case, guys. You can never be ready for this thing. You can never. So I think we should tell the public we have improved, okay? We doctors know how to manage it better. The whole world know how to manage it better. I'm sure that the government and Ministry of Health have put in much more things in place, but there should be no calmness to say we're safe, okay? We still have, yesterday the question was how much beds we have, how much ventilators we have. That should have been there to answer quickly. And that's not my job for to say that, but the public should know that we will never be absolutely ready for increased cases, okay? So please, it goes back to the owners and the people for do the basic things we've been doing to minimize that the people don't get sick.
We have some questions coming in line, online, and so we're going to get to those shortly. They have to do with the vaccines, which we'll talk about as well. But keeping on the variant so we can understand the threat, whether it's beta, gamma, delta, theta, these variants also have some changes from how catching it is to also impacting younger people. I was asking you before we got started, in both your institutions, you've had hospitalized cases for people under 50.
Yeah,
exactly.
That's the next thing also we want to comment, that the fact that these new variants are affecting people of any age, but most importantly, younger people. We see in other countries reports of children being affected with with COVID. And of course, as something that we will discuss it with Dr. Cuellar, also the patients we are seeing in our units are more younger people, people in 30s and 40s. And also...
And severe, like needing ventilation?
Yes, yes.
Wow.
So that's one of the issues with the variants, that the younger people, and because of the shared numbers, we will expect younger people hospitalized and unfortunately ICUs also. So we should, as a country, still feel like we're not out of this woods yet. We need masks, hand washing, and physical distancing.
Yeah. So the question that we do have lined up first, and that's one we're going to get into. So Sheldon Duncan wants to know, how does the vaccine help against the variants? Who wants to take this one?
Well, the idea is that the vaccines will stimulate the immune system to produce the antibodies, so that, and it's shown, there's studies already showing that the vaccines do help quite a bit, so that people don't end up sick, needing hospitalization. It does stop you entirely from catch the variant, okay? It doesn't do that, okay? So not make people inquire about, oh, well, why not take the vaccine if you could get sick? Yes, you could get sick, but the likelihood for you end up in a hospital and for end up in the ICU and die is very smaller compared to 18 months ago because of the vaccines.
And the other important aspect, and I think so we mentioned that before, but it's important for the people to know, is that with the technology that is being used with vaccines, now it's easy for them to go back and also to see, based on the variants, to make improvements into the vaccine. But so far, as doctors say, the vaccines are proven to be effective with the variant that we know. And of course, it reduces the severity of the COVID.
Or COVID numbers, or COVID vaccination numbers, as of yesterday, they were, for fully vaccinated people, it was nearing 30,000. Definitely not near the 70%, which is the standard for herd immunity, which means enough people protected that we're in a safer place. I'm sure, as medical professionals, you have heard every possible excuse or concern that people have. Let's dive into some of those. From what you have been asked so far, why are people not getting vaccinated?
Yeah, I think there should be one genuine questioning of the vaccines.
Okay.
There should be one genuine question of Tylenol. There should be a genuine question for injection and give
antibiotics.
But antibiotics, okay? So I think as a community, as a society, we should be questioning, asking, researching, okay? But there are some ludicrous suspicion about the vaccine. I've been called devil worshipper because our instrument from the devil. We've had and these things are serious, and I think us people who are advocating for vaccination, we too soft. We should be pushing back harder to these anti-vaxxers that come up and, like them people down south where they talk about religion and that one fetus thing and all those things are misleading. Those are not facts. Okay? If you want to tell me, if you want to ask me, for example, that this vaccine questionable because it was made in such short time, for example, then we have one genuine discussion to say, and I can explain why it took so short, because like Jorge said, vaccine technology, just like cars and cell phones, have gone leaps and bounds over the past 20 years. They could make up one vaccine in one quarter the time they used to do it because of advancement in technology. As a matter of fact, one could argue that we take too long to make these vaccines. So that's one of the answers to that question, why it came about. And when they tested the vaccine, because of the crisis, they never do the step by, they do all the steps together almost in terms of the clinical trials.
So usually you test for a couple days, you test a month, and then...
But then did everything together, and so what we may do, just fold with hand now, and make the natural herd immunity, and do the calculation. If we talk about herd immunity, and we may expect 30% death, 30% of $400,000, we did feel right now for 300 plus deaths. If we just not do nothing, we may end up like tens of thousands of deaths. And then see who the ball, why we never do something.
And that's if we had 30%, because we actually have one of the highest fatality rates in this region. And we don't talk about that enough.
Right.
The other important aspect is, as also we discussed it before, is what we are fighting during this pandemic. We are fighting two things. We are fighting the pandemic, and we are fighting the infodemia. You open your phone, and you have a thousand of different messages and people that saying that they know, but with no, as Dr. Cuellar said, with no facts. Mean that the situation with the vaccine, again, is just to emphasize, it's not that the vaccines came out from 6 months. That, remember that we have initially at the beginning of the 2002, we have the SARS and then the MERS, and the technology that came since 2002 and 2013 with those two initial situations, it helped us to develop the vaccine faster. I mean that it's nothing that come up just from a day or two and just like a magic. We have this is a scientific proof and scientific evidence and years of investigation.
Yeah. So Kelsey Dion wants to know, how will the variant affect my body if I'm vaccinated?
Well, it should not affect it seriously, because like we're saying, the vaccine will give you a certain level of protection. It will not protect you 100% from catching the virus, but it should very well lessen the risk that you end up in the hospital and dying. So it's a risk-benefit thing, okay? I mean, we need to also mention the possible side effects of vaccines, like in everything, okay? If you go from here to Belmopan, I won't die on the highway today because I'm not going on the highway today. But anytime you go on the highway, you run the risk of involving something serious. You're going to the bathroom, you could slip down. You take birth control, you could develop clots, okay? So these are all risk benefits every day we play with. So we not say that there won't be side effects of the vaccine. Sure, you could get pain in the area, you could get fever, headache, you feel bad 1 day or two. Tylenol rest and a lot of water should help with that. So please, don't make nobody they say that, whoa, this thing foolproof and this thing is absolutely zero side. There are possible side effects. The vast majority of people don't have serious effects though.
Yeah. Now, I hear what you're saying, and I think you used the term earlier that we have a growing anti-vaxxer community in Belize when it comes to, especially the COVID-19 vaccine, not the other vaccines that we get. But there is also, I think, a bit of hesitation for people because of some of the information they do know. And one of the common ones is, if the COVID-19 vaccination still allows me to get COVID-19, then why get the vaccination?
Well, as we mentioned earlier, if you are getting COVID-19, then it's going to be in a mild form, rather than if you have COVID-19 and then you went in an ICU with a potential possibility of dying. I mean that I think so that by itself is an important reason for get vaccinated, because it's going to be in a mild form.
If I could answer that another way, again, using the analogy about going to Belmopan today, you get in your car, who I'll check with tires, tire pressure, all of that, make sure that we're steering good and so forth. But guess what we do on top of all of that? We put with seat belt when you get in the car. And the reason for doing a seat belt is over 50 years, it has shown that seat belt reduces the risk of getting seriously injured and dying and being thrown from the vehicle, okay? So you're on crash, yes. Only God could tell you if you're on crash or no crash. But you want better in a position if you click on your seat belt during the day. And some people would have quarreled about, well, I put on seatbelt for? You violate my constitutional right if I want. But come on, man, if I tell you these things help save lives, so got some sense and try use it, no, man.
Now, you all do what they call, I think it's continual medical education, CMEs.
Right.
You've been talking with doctors and healthcare professionals across the country, even internationally as well, as we all try to maneuver ourselves through the pandemic. Let's talk about what the research shows in effectiveness for the different vaccines that Belize has access to. We have the Chinese vaccine, we have AstraZeneca, and we're told that we'll be getting Johnson & Johnson as well. And I do believe we have the Sputnik as well. So let's talk about those individual effectiveness and how effective they have been proven against variants like Delta.
Well, remember that Delta is just come up. I think so. We need to have the data coming soon. No, I don't think so. We have the data putting together as yet because that is being in process. No. Now, as you say and as the doctor say, when we talk about vaccines and we talk about any type of medication, there are not medication free of side effects. No? Everything we do have a risk involved, and as using the analogy that Dr. Cuellar has mentioned, no? Even driving to Belmopan is have a thousand of potential possibilities. No? But the same with the vaccine. No? But back to the question, I think so the data for the Delta and the effectiveness for the vaccines, I think so those are being processed at this point.
Yeah, the full data isn't out yet, Marlene, but the question or the answer I think you're seeking is that when you try to compare vaccines, okay, which one better than which one, okay, all of them good. All of them in the 70s and above when it comes to effectiveness, okay? Now, you could talk about maybe the Pfizer a little bit better because the numbers are a little bit higher, but of course that comes with a higher price. But we are quite satisfied that what we've been using so far in Belize, the AstraZeneca, the main one, is very effective. The Chinese, the Sinopharm, and those things are also effective. The J&J, all of them have their pros and cons, and I think we should follow the guidelines set out by the CDC. We should interpret it to suit Belize and go. Nobody here at Belize have that full expertise to say, well, this better than that one. So we gather information, we do that through our CMAs, and believe me, Monday, Wednesday, and Friday at 6 p.m., all the way there in front of the computer, the talk, and we quarrel.
What's the sentiment coming up from? Because we have outbreaks happening in Orange Walk, we have outbreaks happening in Toledo. What's the medical community seeing in those areas? Very concerned,
very concerned. There's always seemed to be a disjointed connection between what's on the ground and what the Ministry of Health is saying, unfortunately. Because when you talk to colleagues, them like, for example, down south, they don't have wall oxygen still yet in some of the areas, which, lad, man, at 18 months now, we could improve on these things. And you hear the nitty-gritty of the daily thing. There's a lot of crying in terms of the healthcare professionals. They are stretched thin, they overwork, and then you see people at the head tables in these press conferences saying that everything is fine and dandy. Everything isn't fine and dandy, okay? Everything isn't even, and with oh, well, the answer is that we just hire 20 vaccinators or 25. That time a long time that thing could have been done, a lot more could be done. There is a disconnect, honestly, between what we on the ground the feel and what the Ministry of Health, the top people, and then they say. And it's fault of no one. I think that just collaboration needs to be done better, no?
It's concerning because these areas they don't have the tertiary care institutions that we have here in Belize City, and I think in Belmopan too. So what is the plan for if there's intensive care specialist needed or intubation? And these are things we ran into in the last spike that we saw.
Yeah, well, as we usually discuss with Dr. Cuellar and also with the colleagues, is that the most important thing is to recognize that a patient is becoming sick, and also the timing of sending the patient to the tertiary level care services. So that is one of the, we most of the time insist that the patients need to be access the service on time.
Mm-hmm. And you're still finding that people are coming in late stage with COVID-19?
Yes, yes. I think the past 3-4 months when there's been this relaxation, people seem to have forgotten what we went through later last year, and just get relaxed. And I would have feel like people thought that COVID done, no? And we still see them coming in late and not appreciating how seriously ill they can be, no?
Yeah.
The way to help with that, vaccinate, guys.
Yeah.
Vaccinate.
So I know you got around to some of the questions you've been asked about vaccinations. What are some of the concerns that you get when you hear people talking about not wanting to get vaccinated?
Well, there are many concerns, and again, it's basic on what they are listening and to seeing in the social media, no? Mean that the things are allergic reactions. The things are probably the most concerning one is the possibility of clots.
Yeah.
But as you mentioned already, we have a huge amount of people being vaccinated, and we are not seeing, except for the most common ones, that is basically pain in the site of the injection.
Yeah.
Probably the patients experience fever for a day or two, some chills, generalized muscle ache. Those are the most common symptoms that we see, fortunately. No?
Let's tackle the blood clot one, because that's what had people very scared. There were cases, there were incidents reported in Europe, and it really became, I think, international headlines, and people really started to develop this fear. So let's talk about the link with blood clots and vaccinations and how much at risk we are.
Well, as the possibility of clots is there, and as however, we need to put in the balance the risk of and benefit, no? And then the possibilities and the numbers of clots that we've seen definitely are not as much as we can say, okay, definitely we need to remove this vaccine because it's too dangerous compared with other examples like the Dr. Cuellar mentioned, the use of contraceptives. No? Compared with that, we see more cases of clots using contraceptives than compared with the vaccines.
Yeah. What about the concern that people have that because it's a new vaccine, you don't know? I mean, we've all seen the movies, right? A year later, that's when you see the scary things happen. And so Hollywood has painted this picture to us that it's a possibility. We don't know what a year after being vaccinated we're going to feel like.
We don't know a year after, Marlene. We don't know 2 years, 10 years. I don't know if everybody angry or another AIDS or another head because of the vaccine. What's the alternative? Sit and do nothing? Okay? It's a risk-benefit kind of choice you have to do. And it's you can't talk about next year if you don't live. So if we're saying that the vaccine has shown, proven scientifically, to minimize the risk of dying and getting seriously ill, then we do that now, okay? And yes, you asked the question about the blood clots. Each individual needs to have one discussion with the healthcare provider and say, you know what, I 52, I'm obese, I got blood pressure, I got sugar, I had blood clot last 2 years. What are my risks, benefit? Am I safe? What can we do to lessen the chance of something? See, a simple thing like maybe taking some aspirin before might lessen the risk, okay? But you need to have that one-on-one discussion and not just jump up and say, well, I know I'm doing it because I had one blood clot 10 years ago, okay? And I mean, nowadays, thankfully, if you develop symptoms where it might be connected to one blood clot, you get to the correct place and you get diagnosed early of one blood clot, and we have how to treat these things. No? We have another big thing after the blood clots, that the heart problem in our younger children. Yes. I mean, we have to be open that different things can happen. We have the myocarditis that have been seen in our younger people. That's true. Those things are very true, but it's a risk-benefit that you're...
And so when you say risk-benefit, it's saying, okay, you may have a small percentage of perhaps developing a blood clot.
Right.
But we don't talk about it enough, but long haul COVID, these people are facing systemic issues, all different organs being affected.
Yeah, just to, I believe, also something that we've been sharing with Dr. Cuellar is we follow the patient that we have in the unit, and the post-COVID situation for patients that are in ICU, for some of them are very devastated. We have patients that they are not being unable to get back to work because they still having, they experience more than 70 to 80% of lung compromise, and they fatigue, they are extremely difficult to mobilize, they still using oxygen. And one of the important things is that remember that after X amount of days, you are not entitled to Social Security.
Yeah.
Also, you have the possibility to lose the job, or I mean,
These are situations you've seen?
Exactly. The capacity to integrate to your economical and your social and family life is very, very challenging.
Yeah. I know people who've spoken about not even getting back taste and smell for a long time after. Yeah. That's just one of the milder symptoms. You're talking about compromised lung, scar tissue on the lung. Right. The brain fog is also a big thing too.
Yeah. Fatigue, though, I think that's the biggest thing. Tiredness, fatigue, I can't explain it. I cannot get my energy back. We do all of the checks, everything within range, but people still complain that they have fatigue. And worst case, like where Dr. Hidalgo said about this oxygen dependency at home, people still they use oxygen from time to time.
But how long after are you talking about? Like a month?
We see cases with Dr. Cuellar that since November that we have the worst outbreak and just this week I saw as a follow-up one of my patients, and they're still not been able to incorporate to their regular life. Wow. And in cases like in some women, they are the hair is dropping. I mean that is the changes are very difficult to face, no?
Let me just say something quickly here. Me, Jorge, and Dr. Arriaga, we have formed this. We have become very close of friends. Well, I don't know if that dream team or the three chiflados they call we sometime. But we have had this great collaboration where I could tap into. He showed me I will use COVID unit technology help us. We bounce off ideas every day, and boy, what you think? Should I do this? Should I do that? What you think? Should I conduct your remdesivir for another 5 days? So we are doing that honestly, quite seamlessly, quite honest. I mean, we have learned that between the three, we stand a better chance of getting success out of patient care, no?
Of course, because it is still trying to learn about this disease as we try to protect ourselves from it. Let's bring this back for a moment. The medical community was extremely vocal about the reopening of the land borders. And I hear you already expressing concerns of this new vaccination campaign. Let's talk about the direction that we're heading. We know that there is a very tough balancing act that has to be done. I've been reading reports and getting stories from other parts of the world where they're entering into lockdowns again, the revolt that they're facing. Not from the business sector, but from people who just don't want to live through that experience again. But it's become a necessary evil. Tell me what it's like from the medical point of view. When you see cases start spiraling up, you know it takes very little to overwhelm our healthcare system, and we start to expect that we'll be seeing more in the short term. What's it like from your end?
Well, me personally, one of the bothersome things I've felt and experienced is that the non-medical people, like the other parts of government and tourism and so forth, look at us, almost want to put us as opposers to them. We are not opposers, okay? And I know that's the correct word. But we are not opposers, we are collaborators. Please don't look at me like a simple and say, I don't know what that is, hardship and economic disaster. I know that better than them. I live on the ground, I know what it means, what Belizeans have been suffering. So listen, then people from medical just think about medical issues. And okay, no. We know the repercussions in the economy, okay? But we also know that if you don't have lives, we can't get livelihood. And vice versa. If you want to fight for say who put which one at top, no make we do that. Make we collaborate better. But no come and look at me like they might not appreciate the economic impact. We do, and that is why we want to give you advice based on all of that, on the medical part, the economic part, and so forth, because you said it, other countries have been doing a dance. 1 month, then that is 1 month they have to go back. And it's a learning curve for everybody, but don't put us like we in the medical field no appreciate economy and livelihood and those types of things. And the fact that the country need to reopen and economy need to come back. What we for do is that don't they blame everything at this economy and COVID. Or and you know I talk like this. This thing never come. We hear it in the house. You hear it everywhere. Oh, the COVID causes. The COVID never causes. What the COVID does is worsen it. That peel away the scheme of the economic situation our leaders have put us in. Come on, okay? Then what we for do that take lessons out of this and learn for the next pandemic. So that we put in infrastructure proper, we train the people in proper, we expand the services and use our services better instead of going all over the place with our monies.
Is it frustrating? I mean, there's good pros and cons here. So it's good that medical professionals, those of you who are trying to save lives when they're in a critical state and helping other medical professionals as well, you are being asked to provide information and advice. But it doesn't mean that you are dictating the path or the direction that it goes. What's that like?
Yeah, that's the correct. No, we give our advice. Of course, this is definitely the liberty as how to use the information we provide. As we have right now the presence of the vogue of the variants of concern. As I say, it's difficult to say that we have the Delta. We have variants. That means that we can have anyone, or we can have the fourth. We don't know until we have the proper sequencing. But it's the same, that if you know that something is threatening you, then you need to have your different measures put in place. No? Same thing, we have this information now. Now the different epidemiological strategies need to put in place to trying to control that. But what we don't want is to face again a scenario like November, December, or worse than that. We don't want,
would be worse.
It could be worse because, of course, we are. But it's something that we don't know. But we don't want to wait until that happens.
No, it's not just about. And I think you mentioned it earlier. It's about knowing that we can be as prepared as possible. Let me come back to one of the points I made earlier. We haven't dived into the details as yet, but why does Belize have a higher fatality rate than other countries? One of the highest in the regions.
I think that, I mean, globally, we never know how to manage patients that have become seriously ill in ICU. We have been lagging behind in terms of the exposure, the experience, and we never have all of the resources at the beginning. We never have ventilators. We still don't have enough human resources. All of our human resources concentrated at Belize City. When I go up and see me, is always, hey, what's happening in the regions, the other hospitals? Stop make we think that everything that Belize City we need to deal with Stann Creek people and PG people, they deserve quality health care as much as they could get here in Belize City. So we should have by now set up smaller units in the regions to help these things. That's why the fatality rate has been so high, Yeah.
Yes, as also the initial phase of the COVID put all the healthcare systems in the world in a difficult position. If you have, I usually say, let's put the example of countries, developed countries with all the infrastructure, and they face a serious problem. I mean, if we compare with country with our health system that we know, of course, it's very difficult that we can say that we're going to be able to respond, because our health system is not as strong like those countries that they are already in trouble. I mean, that's one of the things that we can say is the reason why at the beginning we have this high fatality rate. We know more now, and we have more knowledge and also some more resources, but we don't want to test those resources.
Okay. So Tyler Smith wants to know that when other vaccines become available, for example, Pfizer, will they consider mixing them to improve efficacy, as some international sources have reported?
Yeah. At the same time, I will tell that person that there are studies who say the other thing. So there are some studies say that it doesn't offer any more advantages, or it could be counterproductive. It
was like the 8-week versus 12-week with AstraZeneca.
So that's everyday information, changed twice a day. So we have to look at it in a whole to see what best advice can be given. And back to your question about, it's frustrating advising and the people at the top cherry picking what advice they want to take. And that's my pet peeve, no?
But you're still there providing advice.
Well, not really, but that's another objective of this thing, no? But again, when advice is given, it's given holistically. No look when I say we only look at the sector of the medical part. We know what it means economically also. So please, if you say we're advisors, then take the advice, okay? And I know you said it. There are factors all over this one. They push the prime minister for do this and that one day, and poor man must be confused. They hear all of these expert advices, no? But I guess you have to figure out which one has proven so far.
Based on your expert advice, what is your recommendation with the detection of a new variant as to how we move forward? Think about it a little while. Let's get Dr. Hidalgo first, right?
You talk too much, sure?
No.
Well, I think so. Some of the recommendations have been put in place already.
Okay.
I think so. At some point, they will start to release it. I don't want to interfere with that. No, I mean that I think so. The advice and the information was provided when we knew that we have these variants of concern. The information was put it, and I believe Dr. Diaz, she already presented the recommendation that the group provide. I mean that we will see some changes in different areas of probably curfews and all different aspects. What we don't want is we don't want to get into a full lockdown.
So the medical community is not advising a lockdown.
No. I
you want stricter measures?
Of course, and this goes back to the onus, Marlene, that the way to prevent, to stop things is from the people themselves. No government and no medical advisory group. The people themselves have to realize, yes, we are tired, the change of life has happened, but continue use with masks, wash your hands, social distance, calm down on the partying, and so we ain't got enough time to do that afterwards. And we could make up. Believe me, you could make up for party. We can't make up for life. But I could party harder 3 times more down the road than now. So just make we calm down, make we take at least one another year and say, you know what, we need to prepare so that we could get out of this slowly. Increase our vaccination and continue face mask wearing properly. Continue washing our hands and that physical distance. If we do that, maybe we are get out of this with minimum trouble.
And those simple measures that we've been insisting over the last years, and then it's been proven effective. You see the number of flu cases, and Dr. Cuellar is going to agree with me, is less. The flu cases.
Less gastroenteritis, less flus.
Exactly.
What else?
Less dengue, even the mosquito dengue afraid for the mask.
But it must be frustrating because it's almost like we're victims of our own success.
That's true.
We get the numbers down, we get relaxed, and then we start to see the spike again. And we've all been here. we have all had this conversation. At least this is the third time around we're having, or fourth, that we're saying we got to get serious again. But how does having the variant change the seriousness of this conversation this time around?
Well, you go back to the fact that the variant, this one, what we suspect, is more catching. So we definitely have more numbers. More numbers mean hospitalization, more strain for the healthcare system, and possibly more deaths. No, so it's not too complicated. I mean, one more catching virus will lead to higher numbers. Will lead to more people getting sick, and the best way, not for import 10,000 more ventilators. Okay, therefore, wear your mask, wash your hand, and physical distance, and slow down panic partying.
But we also have about 100,000 vaccines. And my numbers may be off, but they have vaccines, and people aren't getting them.
Well, we tried to answer all of the questions of why. Hopefully,
there was one I saw that was interesting, that people said, how can we trust a vaccine that came out so quickly when there still hasn't been a vaccine for HIV and cancer?
Well, as we already mentioned that the vaccine, the technology for the vaccine has been developing since 2002 with the first SARS cases.
Okay.
Then with the MERS also, I mean, with those technology that essentially we start developing since 2002 that help us, and we already have this platform that basically help us to put this vaccine together in a more faster time.
So it's like a template. It's like when you want something, you find a template online and fit in what you need.
I would have, the last discussion I had like for build one house, we don't have the what I call it, the foundation, then don't build the wall. I had to come on and put on the roof. So that like one prefab house, or I don't know what you want to call it, but that's what going on with this vaccine. They don't have the foundation, they don't have the sides, they don't have all the doors, they put on the roof. And like I said, there were some who was seriously saying that we take too long. That roof we should have been put on in half the time. But who knows, the next time for sure, vaccines will be developed even in a shorter period. That not means say bad, that means that technology, and just like our cell phones, different from 20 years ago.
One of the things that the World Health Organization has expressed as a concern so far is that if we continue having outbreaks, even an outbreak of the Delta variant, that the virus may mutate again into a new variant that may not be protected by the vaccine. Can we break this down?
Yeah, as I think so also, we've been saying that the natural way of a virus is to live. And that means the virus is mutating all the time. There is no way we are going to stop that. Now, there are some variants, and all the time we have new variants. Some are irrelevant, and some other are more relevant. And like the Delta right now is becoming dominant, but tomorrow, for sure, we will have a new variant that we cannot stop that. That is going to be, this one is more fast, it's easy to catch, it's more transmissible, but probably the next time we are going to have one that is going to be more deadly, and that's we don't want. No? I mean that there is no way we are going to stop that. We are going to have variants all the time. Now, what we want is, of course, is to reduce the amount of cases, because if we have more cases, then the virus is going to have the ability to do more. No?
Yeah.
I mean, that's essentially the thing. And if, of course, the fear that everybody have is that at some point we are going to have a variant of high consequence. And that means we are not be able to diagnose. The treatment that we have now is not going to be effective, and it's going to be very, very dramatic. No?
And the virus changes less, or when we control the spread, you don't give the virus a chance to change or to mutate even more.
Exactly.
Okay, so from the variants that have been identified so far, the biggest changes on the impact on humans is that it's more contagious, it's easier to catch, it affects a younger age, and even children. Has any of the new variants proved to be to cause more severe symptoms so far?
No, none of them.
Okay.
Thankfully, that like or I said, God forbid one will change and get more deadly, meaning that out of 2 people, 1 dead.
Yeah.
Okay, we catch it on that, we don't want. But again, we did say how changes will happen, mutations, variants when they come along, other virus when they come along. It's our responsibility to be prepared. Just like how I like use the analogy here in Belize, we good for hurricane. We good for preparing ourselves as best as any other Caribbean country and so forth. No, okay. So hopefully for these types of pandemias and ailment to the country, we can in the next 10 years, 15 years boast that we are prepared for or better prepared for other things that may come along. No?
2 final questions. 1, is it safe for pregnant women? Is there enough research for that?
For what, the vaccines?
Yeah.
Oh, not as yet. It's not conclusive. No,
Okay.
It's not conclusive.
So that's 1. Secondly, do you think that it should be mandatory?
That's a good question. There are many countries that they are thinking on that. And I think so. Some institution in the United States, they are making mandatory for the people to get vaccinated. Of course, one of the hospitals they are doing that in the U.S. And of course they are, as everything else, they are facing some troubles as well. No, but I think so that is we will see some countries and the experience of some countries that are doing that soon.
No, I think that we should keep our civil liberties, no, and give the people the option to choose and not choose. I come up with a good analogy yesterday, no, when one restaurant owner and he have one employee, one waiter, we're against a religion for use deodorant, for example, and develop a body odor. If you go in a restaurant and the waiter come over you and serve you and he smell with one body odor, you don't go back to the restaurant again. So the employer have the right to say, my boy, your arms stink. Put on deodorant or do something, or else,
so you mean like,
or else you can't work here.
Yeah, so okay, making it as a part of
the requirement for work.
Requirement for employment. That's an interesting one as well. Yeah. All right, closing thoughts. We are out of time, but I do want to talk about just that final push. We need people to be vaccinated. We need people to take this the safety precautions. And we need people with symptoms to go to the hospital early. There's a lot of education that has to happen. Give me your 1-minute pitch to our viewers.
You said everything already, Marlene.
Yeah, but you guys have your own style.
Well, this is a matter of civil responsibility. We want our kids to have an opportunity to have a good life, and I think so. We need to set the example. I mean that as we know, vaccination is a decision, and I think so. A year ago, when we started the pandemic, everybody was hoping to have a vaccine. Now the vaccine is available. Some of our neighboring countries, they are struggling and trying to get the vaccine. Example, Guatemala people, they are going to Mexico to get vaccinated because there are not too much vaccines there. I mean that we have the vaccines here.
Again, that's second what you guys have said. It relies on the responsibility of the person. Proper face mask wearing, washing your hands, physical distancing, and take advantage of the vaccine. Okay.
All right. Well, thank you for answering some of the questions this morning. There are more coming in now, but that's all we could manage for today. Maybe we do a round 2 at another time. Thank you so much.
Thanks, Marlene.
All right, we're going to go ahead and take a break. When we come back, we're going to be talking about the latest poverty and unemployment numbers. So please stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.